Good morning, graduates, family and friends, and distinguished guests. And dear graduates, I want to congratulate you and celebrate your incredible resilience and your many accomplishments. As the president of the University of Minnesota, it's my privilege to be a part of the School of Public Health commencement to award Minnesota Commissioner of Health Jan Malcolm with an honorary Doctor of Laws degree for extraordinary public service. This degree is the highest honor that the university bestows, and it is my distinct pleasure to grant it to Commissioner Malcolm. I wish we could be together on the Northrop Auditorium stage today, but since that's not possible, I'm so happy that I'm able to connect with you in this way. Traditionally in this ceremony, I would place the academic hood over Commissioner Malcolm's shoulders, but since we're in this extraordinary time, we will save the hooding for another day. The other element of this important ceremony is the formal citation granting this degree, which I will read now. Jan Malcolm, because your 4 decades of leadership in public health, health policy, and healthcare delivery has given the people of this state the opportunity for a better life, because you challenge everyone, including yourself, to never forget those who are underserved, to treat them with dignity, and to work relentlessly on their behalf, because you champion whole person care for those with disabilities and celebrate, promote, and support their capacity to achieve full and empowered lives, because your thoughtful, collaborative, and strategic approach to problem solving earned you the unique distinction of serving as the Commissioner of the Minnesota Department of Health under 3 governors representing both sides of the political aisle. Because you are leading the people of Minnesota through this dangerous pandemic with determination, steadfast hard work, and an absolute dedication to science. The Regents of the University of Minnesota, upon recommendation of the faculties, confer upon you, Jan Malcolm, the degree of Doctor of Laws, honoris causa, May 16th, 2020. Before closing, I would like to express my sincere gratitude for all you've done and continue to do every day to raise the level of health for the people of this great state. And I'm especially proud and comforted by your leadership, your immense experience and knowledge as you've helped guide us through this challenging time. Congratulations, and thank you, Commissioner Malcolm.
Thank you so much, President Gabel, for those kind words and for this incredible honor. I'm deeply, deeply moved by receiving this award from the University of Minnesota School of Public Health. And thank you, Dean Finnegan, and to my many dear friends and colleagues here at the school. It really is an honor that I have a hard time putting into words how deeply touched I am by this. When I got President Gabel's letter, I read it a couple times, and I must admit, I originally thought, well, this must be a joke from some of my friends, because I've said so often how much I wish that I had been able to receive a graduate degree from the University of Minnesota School of Public Health. And I have very few regrets in my career. I've been such a fortunate person. But one regret I do have is that I didn't earn this degree the old-fashioned way. So congratulations to those of you who've worked so hard to get your degrees here today. I bet you looked forward to graduation as a big reward, but I bet you didn't imagine it like this, and certainly I didn't either. I certainly didn't imagine that I would spend these last few years of my public health career quite like this either. When Governor Walz reappointed me to be Commissioner of the Minnesota Department of Health in January of 2019, boy, that feels like a long time ago, I had all kinds of big ideas about what work I would be doing. I was just so excited to be able to work on the big issues of public health, the things that have been with us for a long time, health inequities, and really feeling the momentum shifting toward a much deeper commitment to working on health equity in our state and in our nation. I also was really, really excited about working on real health reform, not just health insurance reform and not just getting more effectiveness and efficiency out of the health care system, as important as those things are, but real health reform. Now that more than 3 people know what the social determinants of health are and why it's important, it just felt to me like this was a moment then we really could kind of move forward in not just incremental steps, but in bigger steps to really build a healthier society. Well, but here we are in 2020, in the midst of an unprecedented public health challenge for our state, our nation, and indeed our entire world. Who could have seen a pandemic of this scale coming? Well, I know some people did. I know people have been saying for years it's not a matter of if, but a matter of when. But we couldn't probably have imagined the scale and the speed and the total disruption that a pandemic like COVID-19 would bring to us. But here we are. It's disrupted just about everything about our lives. Not a single person has been untouched by what this has done. It has frozen into place and disrupted and taken away so much that we count on, whether it's the way we do our jobs, the way we relate to our friends and our families, the way we celebrate major milestones in life. It has truly turned everything upside down, and it certainly has disrupted much of the work that we wanted to do, that we need to do, and that we will do again someday. But for now, it feels like the focus of all of us and everything and everyone is all COVID all the time. And in some senses, it needs to be. And yet, this pandemic is also teaching us some really invaluable lessons. We in public health have always known how interconnected the world is, and I think many of our fellow citizens are now seeing that perhaps for the first time, appreciating that health issues, health challenges in another part of the world can so quickly become our challenges as well. It's also, I think, helping us appreciate how important it is that people have access to health care, and how important it is that many of the critical workers that we count on to continue providing essential services have things like paid sick leave, so that they don't feel pressure to keep working when they're sick, and thus helping to spread the virus unwittingly. It's helping us to understand that we have a public health system that is always there, all the time, working to prevent problems from happening to begin with, and how vital it is that that public health system be strong and be ready not only to do the day-to-day work of prevention, but to step forward in times of crisis like this. Usually our success comes from keeping things out of the headlines. And as we all know, one of our great paradoxes is that the better we are at what we do, the more invisible it tends to be. But right now, our work is very visible, and people are very, very much attuned to the importance of basic public health measures, because here we are seeing a classic example that there aren't always cures for some of the biggest threats that face us, that instead we need to work together as a community to try to change the conditions in which diseases can spread, and change the conditions in which people can survive those diseases and thrive coming out the other side of this epidemic. You know, this also makes everyone in public health sit up and remember again that emergency preparedness isn't just the job of a few experts, but that all of us in public health need to be thinking about preparedness all the time. I hope we take a lesson from this, that this is going to keep happening just by virtue of, again, the interconnectedness of the world, what we know about changes in the climate and other things, that we need to get better at watching for and preparing for pandemics on a scale that we have not previously seen. I think this is also making us realize that we need to think out of the box, that when we have an event at a scale like this, it makes us realize that we're going to need some new tools in our toolbox, that some of our tried and true practices just don't scale as quickly or as broadly as we need them to if we're going to figure out how to test populations at a speed and at a scale and follow up on test results with contact tracing and disease investigation at such a scale that we're going to have to rely on different approaches to collecting information, at using technology, at expanding our workforce beyond our traditional ranks. It's really calling for new thinking, and that's where I'm really excited to welcome your new energy and your new ideas into this work and into this field. I'm so very proud of the work of my colleagues at the Minnesota Department of Health, in local public health, in our healthcare systems, here at the School of Public Health, and more broadly at the University of Minnesota, and with our community partners who spend their entire careers trying to fill in the gaps that are left by some of the failures in the systems that don't well serve some of the people at the margins of our society. And I want to again congratulate all of you and welcome you into the field of health into the field of helping individuals, helping whole populations survive and thrive, and to achieve the highest degree of health possible. It's going to take all of us not only to get through this pandemic and through the recovery and the rebuilding that it will bring and the opportunities that it will bring us to invent new ways of doing the work of healing and the work of prevention. So congratulations again on your achievement. I very much welcome you into this professional family and look forward to working with you on the broader set of issues that I know motivate us all to work so hard to try to make Minnesota the healthiest place that it can be. Congratulations on your achievement, and I hope you enjoy this graduation day, however unusual it might be. Thank you.